Welcome back YouTubers to my channel of an everyday life of an Aspie. If you're new, I welcome you all. I'm Aspie. I'm all about creating mental health and awareness and sharing my life stories with Asperger's syndrome and the like, along with hopefully fun and games and now leading up to the end of the year. So if you're into any of these videos that I share with you all, feel free to subscribe at the bottom right hand corner to join me on the bandwagon, and if doing so, feel free to also share these videos with family and friends, as well as turning on the notification bell for future updates. So what we're up to right now, we're up to amphetamine. Right, let's begin this. This is contracted from alpha-methylphenethylamine, which is a potent central nervous system stimulant that is used in the treatment of attention deficit hyperactive disorder, or ADHD as it's known for short, narcolepsy, and obesity. Amphetamine was discovered in 1887 and exists as two enantiomers, levoamphetamine and dextroamphetamine. Amphetamine properly refers to a specific chemical, the racemic free base, however, which is equal parts of the two enantiomers, levoamphetamine and dextroamphetamine, in the pure amine forms. The term is frequently used informally to refer to any combination of the enantiomers, or to either of them alone. Historically, it's been used to treat nasal congestion and depression. Amphetamine is also used as an athletic performance enhancer and cognitive enhancer, and recreationally as an aphrodisiac and euphoria. It's a prescription drug in many countries around the world, and unauthorized possession and distribution of amphetamine are often tightly controlled due to the significant health risks associated with the recreational. Amphetamine increases monoamine and auxiliary neurotransmissions in the brain, with its most pronounced effects targeting norepinephrine and dopamine neurotransmitter system. However, amphetamine causes emotional and cognitive effects such as euphoria, changes in desire for sex, increased wakefulness, and improved cognitive control. It induces physical effects such as improved recreation time, fatigue resistance, and increased muscle strength. Larger doses of amphetamine, however, may impair cognitive function and induce rapid muscle relaxation or breakdown. Drug addiction is a serious risk with large recreational doses, but it's unlikely to arise from typical long-term medical use at therapeutic doses. Very high doses, however, can result in psychosis, for example, delusions and paranoia, which rarely occurs at therapeutic doses, even during long-term use. Recreational doses are generally much larger than prescribed therapeutic doses and carry a far greater risk of serious side effects. The realm of amphetamine is used to treat attention deficit hyperactivity disorder, as mentioned, narcolepsy, a sleep disorder, and obesity, and is sometimes prescribed off-label for its past medical indications, partly for depression and chronic pain. Long-term amphetamine exposure at sufficiently high doses in some animal species is known to produce abnormal dopamine system development or nerve damage. But in the humans with ADHD, pharmaceutical amphetamines appear to improve brain development and nerve growth. Reviews of magnetic resonance imaging MRI studies suggest that the long-term treatment with amphetamine decreases abnormalities in brain structure and function found in subjects with ADHD and improves function in several parts of the brain, such as the right caudate nucleus of the basal ganglia. Current models of ADHD suggest that it's associated with functional impairments in some of brain's neurotransmitter systems. These functional improvements involve impaired dopamine neurotransmission and the mesocortical projection and norepinephrine neurotransmission, and the neurogenic projections from locus coeruleus to the prefrontal cortex. Psychostimulators like methylphenidate and amphetamine are effective in treating ADHD because they increase neurotransmitter activities in these systems. Approximately 80% of those who use these stimulants see improvements in the ADHD symptoms. Children with ADHD who uses these stimulant-like medications generally have better relationships with their peers and family members also, and they perform better in school and are less distractible and impulsive with their behaviours and may have longer attention spans. Careful. The side effects of amphetamine are many and has been varied. and the amount of amphetamine used is the primary factor in determining the likelihood and severity of the side effects that is clearly known. Amphetamine products such as Adderall, Dexedrine, and their generic equivalents are currently approved by the US FDA for long-term therapeutic use. Recreational use of amphetamine, however, generally involves much larger doses which have a greater risk of serious side effects than doses that is used for therapeutic reasons. But on the physical realm of the side effects to look out for, at normal therapeutic doses, the physical side effects of amphetamine vary widely by age and from person to person. Cardiovascular side effects can include hypertension or hypotension from a vesicle response, Raynaud's venom, which is your reduced blood flow to the hands and feet, and tachycardia, which is your increased heart rate. Sexual side effects in males may include erectile dysfunction, frequent erections, or prolonged erections. Abdominal side effects may include abdominal pain, appetite loss, nausea, and weight loss. Other potential side effects may include blurred vision, dry mouth, excessive grinding of the teeth, nosebleed, profuse sweating, rhinitis medicamentosa, which is your drug-induced nasal congestion, reduced seizure threshold, and tics, a type of movement disorder. Dangerous physical side effects are rare at typical pharmaceutical doses. Amphetamine stimulants the medullary respiratory centers, producing faster and deeper breaths. In a normal person at therapeutic doses, this effect is usually not noticeable. But when respiration is already compromised, it may be evident. Amphetamine also induces the contraction in the urinary bladder sphincter, the muscle which controls urination, which can then result in difficulty urinating. This effect can be useful in treating bedwetting and loss of bladder control. The effects of amphetamine on the gastrointestinal tract, however, are unpredictable. At normal therapeutic doses, the most common psychological side effects of amphetamine may include increased alertness, apprehension, concentration, initiative, self-confidence, and sociability, mood swings, elated mood followed by mildly depressed mood, insomnia or wakefulness, and decreased sense of fatigue. Less common side effects include anxiety, change in libido, grandiosity, irritability, repetitive or obsessive behaviors, and restlessness. These effects depend on the user's personality beforehand and current mental state. Amphetamine psychosis could include, for example, delusions and paranoia can occur in heavy uses though, however. Although very rare, the psychosis can also occur at therapeutic doses during long-term therapy. Amphetamine has also been shown to produce a conditioned place preference in humans taking at therapeutic doses, meaning that individuals acquire a preference for spending time in places where they have previously used amphetamine. Pathological overreaction of the metabolic pathway, a dopamine pathway that connects the ventral tegmental area to the nucleus accumbens, plays a central role in the amphetamine addiction. Individuals who frequently overdose on amphetamine during recreational use have a high risk of developing an amphetamine addiction, since repeated overdoses gradually increase the level of accumbens alpha-phos-B, a molecular switch and master control protein for addiction, which overdose symptoms by system: cardiovascular, abnormal heartbeat, low blood pressure, cardiogenic shock, heart not pumping enough blood, cerebral hemorrhage, bleeding in the brain, circulatory collapse, partial or complete failure of the circulatory system, central nervous system, confusion, abnormally fast reflexes, severe agitation, tremor, involuntary muscle twitching, acute amphetamine psychosis, for example, delusions and paranoia, compulsive and repetitive movement, serotonin syndrome, which is your excessive serotonin nerve activity, sympathetic toxidrome, excessive adrenal nerve activity, musculoskeletal system, muscle pain, rhabdomyolysis, which is rapid muscle breakdown, respiratory, rapid breathing, pulmonary edema, which is your fluid accumulation in the lungs, pulmonary hypertension, which is your high blood pressure in the arteries of the lung, respiratory alkalosis, which is your reduced blood carbon dioxide. In your urinary system, you can get painful urination, urinary intention, inability to urinate, no urine production at all, kidney failure. In other systems, you could get in the following: elevated body temperature, mydriasis, dilated pupils, elevated or low blood potassium, hyperpresexia, which is your extremely elevated core body temperature, metabolic acidosis, excessively acidic body fluid. Addiction is a serious risk with heavy recreational amphetamine use, but it's likely to arise from typical long-term medical use at therapeutic doses. Drug tolerance develops rapidly in amphetamine abuse, for example, recreational amphetamine overdose. So periods of extended use require increasingly large doses of the drug in order to achieve the same effect. Chronic use of amphetamine at excessive doses causes alterations in genes expression and the measurement protection, which arise through transcriptional and epigenetic mechanisms. The most important transcription factors as listed produces these alterations are your alpha-FOSB, CAMP response element binding protein, and nuclear factor kappa thing. As I said before, some of this will be shown on the video itself. The effects of amphetamine on gene regulation are both dose and route dependent. Most of the research on gene regulation and addiction is based upon animal studies with intravenous amphetamine administration at very high doses. However, the very few studies that has the high use of equivalent therapeutic doses and changes. This obviously occur at a relatively minor level. This does, however, suggest that medical use of amphetamine doesn't significantly affect the gene regulations. As of 2015, there is no effective pharmacotherapy for amphetamine addiction. Reviews from 2015 and 2016 has indicated, however, that TAAR1 selective agonists have significant therapeutic potential as a treatment for psychostimulant addictions. However, as of February 2016, the only compounds which are known to function as TAAR1 selective agonists are experimental drugs. Amphetamine addiction is largely medicated through increased activation of dopamine receptors and localized NMDA receptors in the nucleus, and combines magnesium ions inhibit NMDA receptors by blocking the receptor calcium channel. One review suggested that based upon animal testing, pathological addiction inducing psychostimulant use significantly reduces the level of intracellular magnesium throughout the brain. Supplement magnesium treatment has also been shown to reduce amphetamine self-administration, i.e. doses given to oneself in humans, but it's not effective on monotherapy for amphetamine addiction. Cognitive behavioral therapy is currently the most effective clinical treatment for psychostimulant addictions. Additionally, research on the neurobiological effects, however, of the physical exercise suggests that daily aerobic exercise, especially endurance exercise such as your marathon running, prevents the development of drug addiction and is an effective adjunct therapy, for example, a supplemental treatment for amphetamine addiction. Exercise leads to better treatment outcomes when used as an adjunct treatment, particularly for the psychostimulant addictions. In particular, aerobic exercises decreases the psychostimulant self-administration, reduces the reinstatement of a relapse, for example, of drug seeking, and induces increased dopamine receptor D2 or DRD2 density of this in the striatum. This is the opposite of pathological stimulants, which reduces the decreased striatal DDR2 density. One review has noted that exercise might also prevent the development of a drug addiction by altering the alpha-FOSB or CFOS immunoreactivity in the striatum and other reward parts system in the brain. So this quickly ends a video based on the amphetamine. Hope you'll have learned something. Smash the like. Feel free to comment below if you've used any of these drugs and has it worked for you, be it if it's like in this class drug of what I'm just saying, amphetamine or ADHD pills or whatever. If it does, how does it, work on the daily for you? And, without them, obviously, what would happen, And if further ado, guys, thanks for supporting this watching. Don't forget to follow me on my social medias, and feel free to also pop into my merch store if you feel to, because there's only 2 more days left for this merch to be given you for the 15% off discount. And no further ado, guys, thanks for support, and I'll see you again soon.